Have you ever wondered if the pills you take every day could be silently harming your heart? As a heart surgeon with decades of experience, I've seen countless seniors walk into my office worried about chest pain, breathlessness, or sudden fatigue, only to discover the cause isn't just aging or stress. It's the medications they've trusted for years. In this video, I'm revealing the 7 most dangerous pills that millions over 60 take daily, quietly damaging their heart health without them even realizing it. You need to watch until the end because one of these pills could be in your medicine cabinet right now, and knowing the truth could save your heart and your life. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Pill number 7. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, commonly referred to as NSAIDs, encompass a wide range of medications such as ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin in higher doses. These drugs are frequently used by seniors to manage chronic conditions like arthritis, joint pain, muscle aches, or back pain, which become increasingly prevalent with age. Many individuals over 60 rely on NSAIDs daily, often without fully understanding the significant risks these medications pose to their cardiovascular health. NSAIDs work by inhibiting enzymes that contribute to inflammation, thereby reducing pain and swelling. However, this mechanism can have unintended consequences on the cardiovascular system. These drugs can elevate blood pressure by causing the body to retain sodium and water, leading to fluid buildup. This fluid retention places additional strain on the heart, which can be particularly dangerous for seniors with weakened or aging hearts. Over time, this added pressure may contribute to serious conditions such as heart failure, atrial fibrillation, an irregular heartbeat, or other cardiovascular complications. Prolonged use of NSAIDs can also damage blood vessels and impair kidney function, both of which are critical for maintaining a healthy cardiovascular system. The kidneys help regulate blood pressure and filter waste from the blood, and their reduced function can exacerbate heart-related issues. For seniors already managing high blood pressure or taking heart medications like ACE inhibitors or diuretics, NSAIDs can interfere with these treatments, reducing their effectiveness and silently increasing cardiovascular strain. The danger lies in the fact that these effects may not be immediately noticeable, allowing damage to accumulate over time. Seniors should exercise caution when using over-the-counter NSAIDs, as their accessibility can create a false sense of safety. Safer alternatives for pain management, such as acetaminophen, Tylenol, or physical therapy, may be better options for those with heart concerns. Always consult a healthcare provider before using NSAIDs for more than a few days, especially if you have a history of heart disease, high blood pressure, or kidney issues. Pain relief is important, but it should never come at the expense of your heart health. Pill number 6. Thiazolidinediones, certain diabetes medications. For seniors managing type 2 diabetes, thiazolidinediones, TZDs, such as pioglitazone, Actose, or rosiglitazone, Avandia, are sometimes prescribed to help control blood sugar levels. While these medications can be effective for diabetes management, they carry significant risks to the heart, particularly for individuals over 60 who may already have underlying cardiovascular conditions. TZDs work by increasing the body's sensitivity to insulin, but they can also cause the body to retain excess fluid, leading to swelling, edema, in the legs, ankles, or other areas. This fluid buildup places additional stress on the heart, increasing the risk of congestive heart failure, a condition where the heart cannot pump blood effectively. Seniors with diabetes are already at a higher risk for heart disease due to factors like high blood sugar, high cholesterol, and hypertension. Adding a medication that exacerbates fluid retention creates a dangerous combination that can worsen heart health over time. One of the most concerning aspects of TZDs is their ability to mask early signs of heart failure. Symptoms such as fatigue, shortness of breath, or swelling may be mistaken for normal aging or diabetes-related issues, delaying critical intervention. For seniors with a history of heart disease, even mild heart failure, or risk factors like obesity, the use of TZDs can accelerate cardiovascular damage. Despite their effectiveness in controlling blood sugar, the potential harm to the heart often outweighs the benefits for many older adults. Fortunately, safer alternatives for diabetes management exist, such as metformin or newer classes of medications like SGLT2 inhibitors, which may even offer cardiovascular benefits. If you are taking a TZD, discuss with your doctor whether a different medication might be more appropriate, especially if you experience symptoms like swelling, weight gain, or difficulty breathing. Managing blood sugar is critical, but protecting your heart is equally important. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Pill number 5. Sedative hypnotics, sleeping pills. Sleep disturbances are a common issue among seniors, and many turn to sedative hypnotic medications like zolpidem, Ambien, esopacolone, Lunesta, or older benzodiazepines like diazepam, Valium, to improve sleep quality. While these drugs may provide short-term relief, their long-term use can pose serious risks to heart health, particularly for those over 60. Sedative hypnotics work by depressing the central nervous system, slowing down brain activity, heart rate, and blood pressure to induce sleep. While this calming effect may seem beneficial, it can reduce the body's ability to respond to physiological demands during sleep, such as maintaining adequate oxygen levels or responding to stress. One significant risk is the development or worsening of sleep apnea, a condition where breathing repeatedly stops and starts during sleep. Sleep apnea places immense strain on the heart, increasing the likelihood of arrhythmias, irregular heartbeats, hypertension, or even heart failure. Additionally, sedative hypnotics can interact with other heart medications, such as beta blockers or calcium channel blockers, reducing their effectiveness and compromising treatment for existing heart conditions. The risks are compounded in seniors, who are more susceptible to side effects like confusion, dizziness, and falls, which can lead to injuries or further cardiovascular complications. Long-term use of these medications can also contribute to cognitive decline, which may indirectly affect heart health by making it harder to manage medications or lifestyle factors. Instead of relying on sedative hypnotics, seniors should explore safer alternatives for improving sleep, such as cognitive behavioral therapy for insomnia, CBTI, relaxation techniques, or addressing underlying causes like pain or anxiety. If you are taking a sleeping pill regularly, consult your healthcare provider to discuss the risks and explore non-pharmacological options to protect both your heart and brain. Pill number 4. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, such as amitriptyline, nortriptyline, or imipramine, are older medications historically used to treat depression, anxiety, or chronic pain conditions like neuropathy or migraines. While effective for some patients, TCAs carry significant cardiovascular risks, particularly for seniors over 60, and their use has largely been replaced by newer, safer antidepressants. TCAs can disrupt the heart's electrical activity, leading to potentially life-threatening conditions such as arrhythmias, heart block, a disruption in the heart's electrical signals, or sudden changes in blood pressure. These risks are especially concerning for seniors with pre-existing heart conditions, such as atrial fibrillation or bradycardia, slow heart rate. Even at low doses, long-term use of TCAs can accumulate damage, increasing the likelihood of cardiovascular events. Beyond direct heart risks, TCAs can cause side effects like dizziness, orthostatic hypotension, a sudden drop in blood pressure upon standing, and sedation, which heighten the risk of falls and injuries in older adults. These side effects can exacerbate existing health issues and create a cycle of worsening heart and overall health. Unfortunately, some healthcare providers continue to prescribe TCAs due to their low cost or familiarity, despite the availability of safer alternatives like selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, which have a better safety profile for the heart. If you are taking a TCA and experience symptoms like heart palpitations, dizziness, or excessive fatigue, contact your doctor immediately. Regular monitoring and an open conversation about switching to a safer medication can help protect your heart while still addressing your mental health or pain needs. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Pill number 3. Decongestants, pseudoephedrine and phenylephrine. Decongestants like pseudoephedrine, Sudafed, and phenylephrine, commonly found in over-the-counter cold, flu, and allergy medications, are widely used by seniors to relieve nasal congestion, sinus pressure, or seasonal allergies. However, these medications can pose significant risks to heart health, particularly for those over 60, due to their effects on the cardiovascular system. Decongestants work by constricting blood vessels in the nasal passages to reduce swelling and congestion. Unfortunately, this vasoconstrictive effect is not limited to the nose. It affects blood vessels throughout the body, including those that supply the heart. This can lead to elevated blood pressure, increased heart rate, and added strain on the heart muscle. For seniors with existing hypertension, heart disease, or other cardiovascular risk factors, this additional stress can trigger serious complications, such as heart palpitations, arrhythmias, or even heart attacks in severe cases. The side effects of decongestants, such as jitteriness, anxiety, or dizziness, are often early warning signs that the heart is under strain. Seniors are particularly vulnerable because age-related changes in the body, such as reduced kidney function or stiffer blood vessels, amplify the impact of these medications. Many people mistakenly assume that over-the-counter drugs are inherently safe, but for older adults, even short-term use of decongestants can be risky. To minimize these risks, seniors should carefully read medication labels and avoid products containing pseudoephedrine or phenylephrine, especially if they have high blood pressure or heart disease. Safer alternatives, such as saline nasal sprays, steam inhalation, or antihistamines, for allergies, may provide relief without compromising heart health. Always consult a healthcare provider before using decongestants, particularly if you are taking other medications or have a history of cardiovascular issues. Pill number 2. Proton pump inhibitors, PPIs, the hidden threat to long-term heart health. Proton pump inhibitors, PPIs, such as omeprazole, pantoprazole, and esomeprazole, are among the most widely prescribed medications for managing acid reflux, gastroesophageal reflux disease, GERD, and heartburn. These conditions are particularly common among seniors, and millions rely on PPIs daily, often viewing them as a safe, long-term solution. However, emerging research reveals that prolonged use of PPIs can pose significant risks to cardiovascular health, particularly for those over 60. PPIs work by significantly reducing stomach acid production, which alleviates the burning sensation of acid reflux and protects the esophagus from damage. While effective for short-term symptom relief, this reduction in stomach acid can disrupt the body's ability to absorb essential nutrients, most notably magnesium. Magnesium is critical for maintaining normal heart rhythm, muscle function, and energy levels. Chronic low magnesium levels, known as hypomagnesemia, can lead to serious complications, including irregular heartbeats, arrhythmias, fatigue, muscle weakness, and even seizures in severe cases. Beyond nutrient absorption, long-term PPI use can alter the gut microbiome, the delicate balance of bacteria in the digestive system. This disruption can promote systemic inflammation, a known contributor to atherosclerosis, hardening of the arteries, and other cardiovascular diseases. Studies have also linked prolonged PPI use to an increased risk of heart attack and stroke, particularly in older adults who may already have underlying heart conditions or risk factors such as high blood pressure or diabetes. For seniors taking PPIs for more than a few weeks, it's critical to reassess their necessity. These medications are often prescribed for extended periods without addressing the underlying causes of acid reflux, such as dietary triggers, obesity, or hiatal hernia. Lifestyle changes, such as avoiding acidic or spicy foods, eating smaller meals, and maintaining a healthy weight, can often reduce or eliminate the need for PPIs. If long-term use is unavoidable, regular monitoring of magnesium levels and heart health is essential. Seniors should work closely with their healthcare provider to explore alternative treatments, such as H2 blockers, e.g., ranitidine, or antacids for mild cases, and ensure that PPIs are used at the lowest effective dose for the shortest possible time. Prioritizing heart health means addressing the root cause of symptoms rather than relying indefinitely on medications that may silently harm the cardiovascular system. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Pill number 1. Calcium channel blockers and their risks for seniors. Calcium channel blockers, CCBs, are another class of medications commonly prescribed to seniors for conditions such as hypertension, high blood pressure, angina, chest pain, and arrhythmias, irregular heart rhythms. Medications like verapamil, diltiazem, nifedipine, and amlodipine are among the most frequently used. While these drugs can be life-saving for managing cardiovascular conditions, certain types, particularly older formulations like verapamil and diltiazem, pose significant risks for seniors, especially when used long-term or without proper monitoring. How calcium channel blockers work. CCBs work by blocking the entry of calcium into the muscle cells of the heart and blood vessels. This action relaxes and widens blood vessels, improving blood flow and reducing the workload on the heart. For seniors with high blood pressure or angina, CCBs can lower blood pressure and alleviate chest pain. In cases of arrhythmias, they can help regulate the heart rhythm. However, the same mechanism that makes CCBs effective can also lead to adverse effects, particularly in older adults with age-related declines in heart function. The dangers of calcium channel blockers for seniors. Seniors are particularly vulnerable to the side effects of CCBs due to age-related changes in heart and kidney function, as well as the likelihood of taking multiple medications. Below are some of the key risks associated with CCBs. 1. Excessive heart rate slowing. Certain CCBs, such as verapamil and diltiazem, are known as non-dihydropyridine CCBs and have a pronounced effect on slowing the heart rate. In seniors, whose heart function may already be compromised due to age or underlying conditions, this can lead to bradycardia, abnormally slow heart rate. Symptoms of bradycardia include dizziness, lightheadedness, fainting, and extreme fatigue, all of which can significantly impact quality of life and increase the risk of falls, a major concern for older adults. In severe cases, excessive slowing of the heart can lead to heart block, a condition where electrical signals in the heart are disrupted, potentially requiring a pacemaker. 2. Fluid retention and swelling. Some CCBs, particularly dihydropyridine types like nifedipine and amlodipine, can cause peripheral edema, swelling in the legs and ankles. This occurs because CCBs can disrupt fluid balance in the body, leading to fluid accumulation in the extremities. For seniors, this swelling can exacerbate mobility issues, increase the risk of skin infections, and contribute to discomfort or shortness of breath. 3. Drug interactions. Seniors often take multiple medications for various chronic conditions, increasing the risk of drug interactions with CCBs. For example, verapamil and diltiazem can inhibit the metabolism of statins, cholesterol-lowering drugs, leading to an increased risk of muscle pain or even rhabdomyolysis, a serious condition involving muscle breakdown. Similarly, CCBs can interact with beta blockers, another class of heart medications, amplifying the risk of bradycardia or low blood pressure. 4. Masking symptoms as aging. A significant issue with CCBs is that their side effects, such as fatigue, dizziness, or swelling, are often mistaken for normal signs of aging. This misattribution can delay the identification of medication-related problems, allowing complications to worsen over time. Seniors may continue taking these drugs without realizing that their symptoms are drug-induced rather than age-related. Recommendations for seniors using calcium channel blockers. If you're a senior taking a calcium channel blocker, it's critical to stay vigilant about potential side effects and maintain regular communication with your healthcare provider. Here are some steps to consider. Regular monitoring. Ensure your doctor monitors your heart rate, blood pressure, and overall cardiovascular health regularly while on CCBs. Blood tests to check kidney function and electrolyte levels, e.g., potassium and magnesium, can also help detect early signs of complications. Report symptoms promptly. If you experience symptoms such as dizziness, fainting, swelling, shortness of breath, or a slow pulse, inform your doctor immediately. These could be warning signs of medication-related issues. Explore safer alternatives. Newer CCBs, such as amlodipine, may have a better safety profile for some seniors compared to older drugs like verapamil or diltiazem. Additionally, other classes of blood pressure medications, such as ACE inhibitors or ARBs, may be suitable alternatives depending on your condition. Never stop abruptly. Suddenly discontinuing CCBs can cause rebound effects, such as a rapid increase in blood pressure or chest pain. Any changes to your medication regimen should be made under your doctor's supervision. The importance of oversight. The power of calcium channel blockers lies in their ability to manage serious cardiovascular conditions, but this power comes with the need for careful oversight. Seniors and their healthcare providers must work together to ensure these medications are used appropriately, with regular assessments to confirm their safety and efficacy. Thank you for watching this crucial video about protecting your heart health. So, what have you learned today about the medications that might be silently affecting your heart? I'd love for you to share your thoughts. Comment below with one key takeaway you've gained and how you plan to put it into practice in your life. Your story could inspire others. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-saving advice tailored for seniors like you. Stay informed, stay heart-strong, and take control of your health today.